ladies and gentlemen. Welcome to another very exciting episode of Therapy Tea Time Talk. This is a special episode because we have two awesome guests coming up onto our show today, sharing their expertise in both breathing and meridians relative to movement dysfunction. Okay, and they have been onto our show before, and we have today David, who is a clinical founder, and also Dr. I-Chen, who is a physiotherapist from both New York and Taiwan. Hello, David. How are you?
Hi, hi Richie, hi I-Chen, hi everyone.
Hello, I-Chen. How are you doing today?
I'm good. Hello, everyone. Thank you for having me for today.
Thank you very much for taking, both of you. Thank you very much for taking your time to come up to the show. So without any more delay, let's start jumping straight to our topic of discussion today. So just wanted you to shed some light on the aspect of screening tool in relation to meridians, because I think this is something that a lot of people will be interested in knowing more about. So can you give us a little bit more idea about that specific area?
Yes, but what I said about the meridians would be like a myofascia trained meridians rather than traditional Chinese meridians, right?
Yeah, absolutely. That's fine. Just basically, I think we would like to understand it from your perspective as well, which will be extremely interesting.
Yeah, I think this is quite interesting because how to join every muscle into a train is really unique, and everyone now in the world is trying to mention that we are focused on function rather than just one muscle, right? So if we can join every muscle together and get them into a multiple functions, like if we join erector spinae, hamstrings, and calf muscles into a train so that we can do the extension or maybe flexion, and then we can treat maybe our calf muscles and improve the neck or back pain. That's really I think will be a helpful and useful and even magic things, especially for patients with a severe neck pain, and we cannot touch that. Okay, so yes, that's more focused on the musculoskeletal problems, and that's what I like, because I treat the musculoskeletal patients all the day, and I think after Tom Miles and even Stako mentioned about the connections of the muscle and fascias, that we can treat the patients more efficiently, and even we don't touch the painful side, but we still get good efficacy to treat the mobility dysfunctions and motor control dysfunctions by meridians. That's what I want to talk about. Yeah.
All right, interesting. So take us a little bit more further then. Let's say, could you provide us with some, for example, examples in relation to how these meridians can be incorporated into the clinical practice in that case to improve, let's say, movement or correct movement dysfunctions?
Yeah, I think I remember in 2016, one group from Europe, they said that they proved the myofascial trains by a systematic review, and they say that this is a very good thing that they collect and they structuralize the taxation studies and see if the superficial backline is really existed, okay, and then found that yes, that the reference and the dissection studies they support the connections between the erector spinae, neck extensors, hamstrings, and even the calf muscles. And the same group also do a very good study in 2017, and they found that they can do the remote stretch to reduce the pain over the neck by calf muscle releasing. So that's really interesting to me. And even that, I use the ultrasound, the sonography, and I see if we can release the calf muscle and get the calf muscle fascia more sliding and gliding, and the neckness is really can be reduced. So this is a very evidence-based and also a practical-based, and the efficacy is very good thinking process that we can use the Meridians. Yeah.
What about from like a movement perspective, for example, like if we were to somebody, if they want to improve the lunges, for example, could you provide us with an example how utilizing the concept of the Meridians can help us improve the lunging?
Okay, so like lunging, because one leg will be hip extended, the knee flexed, and one is hip flexed with the knee flexed, right? Okay, so if we do the lunging, but we can't get down to the floor, and we try to improve that, maybe it's coming from the posterior chain, because the posterior chain crosses the knee and crosses the hip. So if we can't get the mobility from the posterior chain, maybe we can't do the hip flexion and the knee flexion very well, right? So we are trying to release the calf muscles, even the sacrotuberous ligaments and the erector spinae, and we can get the mobility recovered. So we sometimes use the flexion tests, like standing flexion tests or sitting flexion tests to recognize if we got a erector spinae tightness or hamstring tightness, and we release that, and we can get a good standing or sitting fractions, and then we do the lunging, and lunging improved. So I think that's a really good clinical, practical improvements that we can use the Meridians. Yeah. So we usually use the motion test like this. Sitting fractions, standing fractions. We can rule out if we got erector spinae problems or hamstring problems, and we release that, and we got a very good fraction range, and we can do a good lunging. Yeah.
What about for the specific lines that you're talking about at the moment? I was thinking about so are there any specific lines that are related to specific types of movements then? Let's take rotation as an example. What about the spiral line? Can you enlighten us a little bit more about that?
Yeah, but before we are really talking about the spiral lines, I would mention the functional lines. Functional lines consist of with our latissimus dorsi, our guru maximus, and the vastus lateralis in the back line, okay? And then in the front lines, that will be a pec majors, rectus abdominis, adductor muscles. And from my perspectives, that's the really fascia trained to do the rotation, okay? Because they cross many big joints and do really diagonal and rotational movements, and that they are all big muscles and superficial muscles, so they can do a very good rotational tasks. Okay, but for the spiral line, for me, it's about the anti-rotational, or maybe it's the stabilized line when we do the rotation, because we are doing rotation in axial, and we are trying not to get down from the side to side, right? And if we can use the very good spiral line stability, that we can maintain our trunk in a axial rotation when we use the front or back functional lines. So that's from my perspective. I will mention the functional line first and then the spiral line, okay? So so if you want to do a very good, like the pitching, you want to do the basketball, and you need to rotation your trunks and use your arms and trying to through the balls and do the follow through, right? So that would be a back chain, back functional chain first, and you rotation your body. But if you just use the functional line, means that you will side bend your trunks. You might be rotate your hips a little bit abduct your hips. That's not the best pitching posture, right? So our spiral line will correct our posture and trying to get our necks back, get our trunks back, but we still rotate our body and get the good potential, potential energy, and then we can through that the ball and give the ball the energy to bring out, right? Okay, so that's what I say. For me, the spiral line is trying to stabilize our trunk. So that's why they through our necks by splenius captus, rhomboid muscles, serratus anterior, optic muscles. That's all small range, more deeper, and trying to stabilize our body. Yeah. So that's from my perspective. I always treat the functional line first, and then the spiral line, and then we can get a good mobility and good energy, and then we can stabilize our body. And that's from I think that also follow the neurodevelopmental process, right? Because we when we are a baby, we are trying to rotate our body first, but we can't stabilize our body, right? So we use that muscles to move, and then we develop some stabilized ability. That's from the spiral line, and then we can do the balls very well. Yeah, that's what I say.
That's a very, very interesting concept because in terms of sports, we're talking about like the ability to generate more energy and power in relation to different kinetic types of angles, right? And I think the way how you put it is very interesting for us as well. So in that case, can I ask you a little bit more about whatever on your opinions in relation to, let's say, meridians or treating meridians in relation to pain management? Because you've given us a very full breakdown in terms of movement dysfunctions, and maybe there are some relationships also between like movement dysfunctions in relation to pain as well. Is that correct?
Yeah, sure. So I always ignore the pain first, because pain is the output. Pain is coming from everything. So what we should do is trying to treat the mobility first, because if you can get a good mobility, you can get a full range of motion, and you can get a better proprioception, right? So we always treat the meridians and trying to get the meridians, I think elongation or can be extended very well. And if we can get them extended very well, and then we can test that at their strength, their endurance, their neuromuscular control, and then we can do the pitching practice, and then we can go to the competition, right? So so always do mobility treatment first to get a good range of motion and good proprioception to prevent from injury, right? And then we can get more in practice and trying to develop our capacity to do some exercise or capacity or competition. Yeah.
And I have a question here, because I think for our audience, there's a lot of them. They might be a little bit confused about the terminology. So can you elaborate what's the mobility you mean? Because sometimes they might think about, joint mobility, or some people, they might think it's flexibility. Can you elaborate that a little bit more?
Yeah, I would say what we said, the mobility will be active mobility, okay? So that's what we tested, the active motion. So that means that someone can control his or her range of motion actively without any pain or any restrictions. But if we want to get into that position, that means that we have to get the passive first, right? So if we treat the meridians, we treat the myofascial chains, the first goal is we're trying to test the passive range of motion. And if the passive range of motion restriction is coming from the meridians or the myofascial chains, that would be a multi-joint restriction. So we test many joints and they all get restrictions. It may be leading to the myofascial chain meridian restriction. So we treat the fascia first. But if it's coming from the joint, you might test that the elbow is okay, but the shoulder is not okay, right? So and we test the joint mobility, joint play, and we found the joint play is a little bit restricted. So we treat the joint later. Yeah. So then we can get the good mobility. What we call is that we can get the passive mobility first, the passive range of motion first, and then we test the neuromuscular controls to see if they can control the new range of motion very well. So that will be an active range of motion. And also what I said is the mobility. So if the mobility is without any limitations, and then we can get capacity or loading into that person and trying to train them to do a very good exercise or competition. Yeah.
So it's kind of like, in a way, like freeing those mechanical restrictions you have in a specific associated joint or area first, and then retraining the motion in a way. Is that correct?
Yeah, sure.
Thank you for letting us on that. And just wondering about that. So in relation to meridians now, and like or muscle-related type of relevance. Okay, so just thinking about your aspect in relation to lines. Are there any significance between these fascia-related lines in relation to breathing? Just very briefly.
It's some levels. Okay, so we should get the passive range of motion first, mobility first, right, and the active range of motion second, and then I'm trying to test the breathing, but I'm not a breathing expert, okay? So I-Chen will do the additional information to us, right? Okay. So then I will test the breathing and see if we got a good breathing, the chest expansions up, anterior, lateral, and then if they got a good breathing pattern. They got a breathing, no breathing compensation, but every motion can cooperate very well with the breathing. And then I tested the gross motor trends, and then gross motor trends with the core activation. Why I said this is because it's all follow the neurodevelopmental process, right? And the breathing is the first thing when everyone was born, right? So that's very important, but everyone will ignore because we think breathing is a very common thing every day we do, right? So I would still test that and see if our motion can cooperate good with our breathing. And then core cooperate good with our breathing and also our gross motor. And I think breathing is also one of the core functions, because if we say core, it means that our chewing and our swallowing, our breathing, and even our and our pelvic floors, something like that. They are all core muscle functions, right? And breathing is one of the important things that if we want to activate our core, okay? So from breathing to gross motor and core activation with gross motor, you can't do very well without good breathing patterns. And then I will get them into the capacity. So that's my process, okay? But for breathing, I just do a very easy breathing, like we test the chest expansions, we test the muscle contractions, test muscle co-activations, something like that. But I think I-Chen will bring us very good additional information about the breathing. Yeah.
So thank you for the explanation there. So I would like to take this opportunity now to bring in the other expert in relation to breathing, Dr. I-Chen. How are you doing today?
Good. How are you?
Good. Thank you very much for coming back onto our show. So we know that you are the breathing expert, and we hope that you can actually share some of your ideas and concepts in relation to breathing with us today.
Yeah, so it's really interesting because we just discussed about the meridian and the breathing. So if we think about the meridian line, I want everybody can picture a line in your mind and think about what is the movement? How can we move with those lines? Right? So when we talk about the breathing, the most important breathing muscle is our diaphragm. And if you want to refer to anatomy trend, it can refer to the deep frontal line, right? So here's a line like this. The diaphragm is about almost in the middle of the line. So when the diaphragm moving, it's moving up and down. And let's think about the two ends of the rope. If you cannot stable two ends of the rope, you cannot move well in between, right? So if it cannot going down, it might be restricted from this line from the top, right? If they cannot moving up, it will be reversed. There might be some restriction coming from the downstream. So basically, if you want to apply the meridian line or the anatomy trend into the practice, I think that would be a really good combination to think about the breathing, about his role moving into this line, right? So if we cannot moving in between, then we can think about our diaphragm. It doesn't know where it is, right? It doesn't know where your diaphragm in the body. So your brain will be confused about, should we go down or go up? Do we really go down right now or do we really go up right now? And in other way, if your diaphragm cannot move in properly, then you might think about using the muscle on this line to help your diaphragm going down and up. So I think that will be the one way to explain how to combine your meridian line with the breathing pattern.
Thank you very much for that. Could you give us a little bit more further elaboration when it comes to, let's say, breathing in relation to doing like motions and movement then? What about in that aspect?
Yeah, so, well, like I just said, if we refer to anatomy trend, we might only think about, oh, it's the frontal line. But think about the structure or think about the whole content of the diaphragm. It might be the only one muscle covering your front and back, covering your left and right. It's cross the midline and also cross the center of our body line. So basically in this way, if your diaphragm cannot contract properly, it might affecting from sagittal plane, it might affecting your frontal plane, it might affecting your transverse plane. So I totally agree with what David just said, because in neuromuscular development, the breathing is the first movement you're going to try when you arrive this world. So in this way, if you cannot breathing well, your whole movement will be affected by that. So if we just talk about the deep frontal line, then it might affecting all the movement or all the muscle function on this line. But also, if you think about the front and back, it might affecting other muscle or other line via their connection to other structure, such as probably the kidney fascia, probably connecting to the iliopsoas fascia, or all the way up, it might be also related to your pericardium, also related to your transverse thoracic. That would be a lot of different structure connected to this muscle. So if it cannot move properly, they will be accumulate some pressure or accumulate some dysfunction on some part along their movement pattern.
So what are some of the good effective ways of practicing breathing then? Let's say for somebody that is completely new to the aspect of breathing, in this case, meridians, and what are some of the good ways for them to start and practice breathing, the most basic?
I think Yeah, there's a lot of ways you can practice breathing. You can find a lot on the internet. But for me, I think the most important one for most of the people, or for most, not everyone, but for most of the people, we need to try to breathe slowly. If you go back to see all the research about the breathing, you'll find in our modern society, we're breathing way faster than like maybe last century's people, right? We come from like 8 to 10 times per minute to all the way up to the 14 to 6 times per minute. So in this way, the best way, or I think the basic way to stop practicing the breathing is to make it slow and also try to breathing out as long as possible in your tolerance.
Yeah, I agree with that, especially for the breathing out, right? So that it is exhalation, right? Because I think if you want to speak something, if you want to sing, if you want to say teaching or something, we have to say the words, and we need a good function of exhalation. But if we can't do a good exhalation, not just that we can speak very well, but also we can't breathing in very good, right? So if we want to breathing in more, we should breathe out first, right? So that's a very interesting thing, because in a lot of patients, I have a lot of patients. They got a very poor exhalation, so they can't speak very well, and they're always saying like this: I can't speak, I can't breathe, like something like that. So if someone had suffered from the breathing problems, how can they do very good motions? How can they doing good exercise or competitions? No, that's no way, right?
Yeah, and I think the breathing is kind of like the running, right? You're like repeat some movement like in a circle. So if you cannot breathe out well, then you cannot breathe in well too, and you are just stuck in some point in this circle. So it will affect all the movement you need. Like if you stuck, like I say, if you stuck in the breathe in pattern, then your muscle cannot contract properly, which means your core muscle, or you can say your transverse abdominal, your internal oblique, your external oblique, they cannot contract properly. So in this way, it can affect almost all the movement you can think about, including walking, including bending forward, including like more functional, such as rotation, such as pitching, etc., etc.
So in your practice, I-Chen, I was wondering then in that case, so is breathing one of the fundamental things that you would help your patients also train as well in that sense?
Yeah, I think in my practice, breathing is definitely one of the most important part, but not everyone will start it with breathing, right? Because some people, they come to you for the shoulder pain, some people, they come to you for the knee pain. It might be related, but the most important thing is that if you can help in them, then you can gain their trust. So you can start to convince them, okay, in my opinion, the original or the root of the problem might come from your breathing pattern. So in this way, you can helping them breathing better. And also, if we think about as a physio, we need to give them the therapeutic exercise. We want them to do it like sometimes as much as they can. Breathing is one thing you will never forget to do in your daily life. So if you have a good breathing pattern, it also can help them to recover their body as fast as we want.
That's a very, very interesting aspect, because if you guys remember, I think one of the previous questions that I've had for you guys before, when it comes to our previous interview, is whether you guys actually give homework to your patients, and if breathing in this case is extremely important, and it's something that they would definitely remember to do. Is that correct, I-Chen?
I totally agree with that.
Something that
right.
I never really forget.
Yeah, we all have the experience, like our client, they forget to do the exercise, or they forget how to do the exercise. But breathing is easy, and sometimes just having that, okay, remember to breathe in slowly, or sometimes just having that, okay, try to exhale longer. Then if they can practice that into their daily life, then they will never forget it, because we're just trying to change their subconsciousness to doing that in the better way.
So when it comes to that aspect of giving homework, then in that case, since you're gonna remember doing it, are there any special ways that you normally try to help them to remember how to practice that specific type of breathing?
Usually I'll having them to do the breathing exercise before they sleep. So it's a very good way, because a lot of our patients, if they have the pain or they really feel discomfort, a lot of them, they also have the sleep disturbance, right? They feel discomfort, they cannot sleep well. So in this kind of practice, it can making them calming down, activate their parasympathetic nerve and make them sleep well. So once they feel great, they will never forget to do it until their brain make it automatically. They will keep practicing that. Usually it will take like between 2 weeks to 6 weeks, depending on how hard to rewrite their movement pattern.
Have you seen any patients in the past that are sleep deprived, and have you also been introducing the breathing exercises to them as well? And has it been quite effective for them as well? Because I understand that if learning how to breathe takes time to learn, and for people that have sleep deprivation issues, definitely it's going to affect the quality of sleep, and I think the breathing might also affect that part as well. Is that correct?
Yeah. So in my experience, that's not everyone, but for most people who like to breathe in with their neck muscle, usually they can get a lot of relief by practicing breathing exercise. So, in this way, sometimes their sleeping problem might cause their syndrome, or sometimes the reverse. So the breathing is just one way to cut in this circle and making them regain the better ability to move their body.
Or another way is also a better way for them to learn how to calm down. Is that correct?
Yeah. And also if you see the research or just see some like yoga master or some meditation master, they're having you saying that, okay, if you do the meditation in the morning and before the night, you might feel great when you sleep, or you can gain the energy for the whole day. But think about what is meditation really for, right? In Buddhism, they'll say, okay, you need to clear your mind. But what do you mean about clear the mind? So there's I forget his name, but I think he's a guru from India. He said that the meditation is focused on one thing. So the best thing you can focus on during the meditation is focus on your breathing. I feel like, oh my God, that's so brilliant. Then I try to do that in the same way. So you don't need to be sitting there to do the meditation. If you are focused enough, actually you can do the breathing exercise into the meditation in any time and any position.
Well, like channeling yourself or putting yourself in that position where it allows you to meditate, so to speak, utilizing the breathing as a channel, eh?
Yeah. And what's interesting, I want to referring back to the Meridian, because we know that there's a lot of Meridian from the Chinese Meridian or myofascial Meridian. But if anyone in front of the screen, you're familiar with the Qigong, they say that you need to practice the Qi with the breathing and some kind of like the meditation, right? So probably that can help in that in some way, but we don't know how that really works in this time point.
Do you guys practice, have you guys ever tried Qigong before?
No?
No.
Yeah.
Not really.
Yeah. I mean, should this be, this is a general opinion now. Like I was wondering, so should like for anybody in general, I mean, is Qigong something that you recommend for them to try as well?
Well, if they're interested in that, I'll have them try it. But one thing is that you need to find a good mentor. I think that will be the point.
You're definitely right about that. Gotta find the right teachers to teach you the right way, so to speak, right? Yeah, very important.
Okay, so David, I have a question about the Meridian line, because we know now the most popular theory is come from the anatomy trend, but also there's a Dr. Stego family in Italy, or there's some other researchers who are also interested in the myofascia line. But they all have a little bit like the minor difference between the lines. So how do you explain their opinion, or how do you explain that in your perspective?
Yeah, I would say every system has their belief, right? So from Miles, he believes what he saw in the lab, the dissection labs, right? And that's the same in Professor Stakel's lab, right? So I would say actually we have no lines, right? Especially for fascia, we think the fascia is a whole capsule, right? So everything, every muscle, every nerves are trying to develop and get into the capsule. So for me, I would say every explain about the myofascial trend is okay, because we develop the trend is trying to explain the function. Like if we do the trunk flexion, we say, oh, trunk flexion is controlled eccentrically by the superficial back line, but it also, you can say, is coming from the Professor Stakel, is the posterior connections, right? And if we are trying to say, oh yeah, we do the rotations from the functional lines or spiral lines. So for Stakels, they also say that we got spiral connections with our trunks and also our arms. So I would say, forget about the lines, really. It's whole connected by the fascia. But I taught a one class in National Taiwan University this semester. It's about the taxation course, okay? And I bring some graduate students, and we do the lower extremity taxations in a whole semester. And we found that the fascia they mentioned is not really good to see. I'm not quite sure if this is because it's not a fresh body, it's coming from some chemical bodies, or so that we can find the fascia very well. But we still can see the fascia between the muscles. They are all connected through the body, not just the one joint or one muscle, or even two joint, two muscles. So the fascia, so far, the fascia theory is not really complete, right? And everyone can say that, oh, I found a new fascial lines, I found a new connections, right? But actually, they are all coming from what I said. The fascia is the capsule. Everything is getting into the capsule. So yeah, I think that would be a good explain. It would be a better explain to the fascia and the fascia trends. So yeah, forget the trends. Yeah, we trying to explain them by functions. That would be a important thing, especially for physio. Yeah. I-Chen, and I want to ask you one question about the breathing. When will you test the breathing in your clinical practice? Like from me, I will do the breathing evaluation after I get the range of motion back, passively or actively, and I tested the breathing patterns and see if the breathing pattern can cooperate good with our motions. But when will you do the breathing evaluations? Can you share some experiences?
Sure, I've been asking that question for a lot of people. So in my practice, I put it into the basic physical examination, because the breathing pattern examination should be really fast, and you don't need to take like 10 or 15 minutes. It may only take you like 2 to 3 minutes. And also during your assessment with the breathing, you can also check where they are trying to help them to breathe. So basically, it's kind of like one part of range of motion test in my practice. and I'll decide it if that's really affecting their problem or not. Sometimes their dysfunction breathing might not really cause their syndrome. So I'll treat the syndrome first, then slowly go back to the breathing. But if the breathing really affecting their problem, such as their neck breathing pattern affecting to the neck pain or the shoulder pain, then I will definitely start treating with the breathing.
Yeah. Okay, that's interesting. Is because when I treat one patient, I remember that he is lying down and with knee flexed and touch the table, and we just do some very little breathing, and he said, I can't breathe and my neck is quite tight, and I got a neck pain. So that's interesting because from your perspectives, you will treat the breathing first, right?
Yeah. In some part of them, right? Because if we go back to something we said about the rope, definitely we can regain in my opinion, we can regain the mobility, or we can regain the range of motion to the top or to the bottom. But sometimes we can let them breathe in better. It can kind of like the self-massage during the whole line or during the whole body. So sometimes that can unlock their limitation, which will make the exercise later way more easier for them.
Yeah.
So I'm still checking the breathing, but not meant to be perfection. If they know how to using the diaphragm core muscle to do the, like I say, to do the circling movement, which means breathing in and breathing out well, then most of the time I'll move on to the next step, unless the problem all coming from their breathing.
Okay, good.
What about for, let's say, the athletes that you're working with as well? Do they have like specific type of breathing drills that they do professionally and also from your end as well?
Oh yeah, that's definitely, they need some different kind of breathing technique. But for me, it's kind of like if you cannot walking, you cannot really running well, right? We know it's different things, but you need to be able to walk, then you can try running. It's kind of like the same thing. You need to know how to breathe in the most efficient way, or in the more basic pattern. Then you can start practicing the special pattern. So let me show you an example. Like if I can think about the tennis player, why they are shouting out during their hitting, right? Smashing, no matter it's from the right hand or the backhand, right? Why they are trying to shouting out? Because when you're trying to do a strong rotation, you need a quicker contraction from those muscles. And by shouting out, it's kind of like the really strong breathing out movement, which can help you contract those rotation muscles faster. So, and that will make them feel better, feel easier. So for some athletes, especially for some athletes in my clinic, if they like to hold their breath during this kind of, we call it like the more speed, this exercise needs a speed, they have more problem than those who don't use the holding the breath technique. But for other part, like the powerlifting, for those people, they need way more stability in normal. So they need to practice how to hold their breathing well. And the most important thing is that you can let them bring their exercise habit to their daily activities. I think that a lot of people, they have this kind of problem, especially for those weekend warrior, right? Oh, I don't have any exercise in the weekday. I work really hard in the weekend, and they have the highest injury rate among all the population, right? Because if they're starting using the bad habit, or it's not the bad, if using your exercise technique into your daily activities, then that will cause the trouble.
It's kind of like putting the wrong things in the wrong channel, right? Would you agree?
Yeah.
It's like not using the right mode.
Yeah. For those athletes, they need like different kind of technique. But what we got to do as a physio, I'm more thinking about how to make them more efficient, giving their body more choice, right? They know one way to breathe. They also need to know the other. So in this way, they can, shift in the mode, like you say. Oh, now it's a game mode. I need to breathe in this way. Now it's a daily mode. I'm shifting back to the daily mode. So we need to make them like the autonomic system. They need to change that without thinking of it. So I think that's one of the challenge for athletes when we're doing the physical therapy, but also that's also a fun thing. I have them back to the most efficient breathing pattern. Then how can we help them apply the technique into their game or into their competition?
All right, thank you very much, I-Chen and David, for coming back up to our show today to share your great expertise in both breathing and meridians, and also in relation to movement patterns dysfunction. And so that's all the time we have in the show today. And thank you again, guys, for everybody that's tuning into the show. It's been fantastic so far to have all of you viewing our show at the same time. It's very, very lovely to have you all. And I hope all of you have a great rest of the day.